Dr. Pedai, something in the news, which is the Fixodent cream, basically the denture cream, the adhesive which people put on when the denture get loose, which is not because the dentures get bad, but because their gums are shrinking. But anyway, they need quite often this cream. And there has been news out there that there's too much zinc in it. And while the body does need zinc, too much is too much of everything. And apparently some people have gotten nerve damage, physically and mentally. I've seen it on television now. Whether they got it from that, I think has to be proven, but maybe you know better than that. Shed some light on that problem with the cream and how it can be fixed.
Well, basically, denture adhesives and creams, Helmut, are nothing more than something to take up some space, and that's all they are. And they're just not only on your shelf but in your mouth. So get the idea that whatever they're composed of is nothing more than a glue, so to speak. It's supposed to be acceptable to the body. You got it. That takes up space. Get the idea?
Yeah.
Whether there's harmful chemicals in this or not, because of the zinc controversy, you know, I'm not 100% sure on that. We'll let the manufacturers handle that. That's their gig to handle. But you know, anything that's not supposed to be in the body, if done in excess, is going to be harmful. So if there is too much zinc in it, and zinc's a wonderful, you know, supplement for your body to have. Right. Obviously, too much zinc, just like too much of any other supplement, is going to be harmful. Now, the point that I'm getting at here is that it doesn't, even if it was perfectly safe to use, why would you want to have gunk, goo, or glue in your mouth to hold, let's use an upper denture as an example. Normally what happens in this case is, over the X amount of years, 5, 10, 15 years, I've seen some of my denture patients have them for 35, 40 years. The denture itself probably did not change on the inside. Part of the denture that fit against your mouth. What changed was the gum and the bone structure in your mouth. Just like we all change as time goes on, putting on weight, losing weight, that sort of thing. That's what happens to the rest of your body. So, what used to fit very neatly and snugly against the roof of the mouth in the case of an upper denture no longer fits that way. There's gaps, there's spaces, and as a result, that upper denture is going to plump. It's going to fall down. No one wants a falling denture. So what people will do is go out and buy the denture adhesive, you know, squirt it in there like it was going out of style, plop it up in there, and I've never met a patient who really liked using that stuff. Because when you take it out, it sticks to the roof of your mouth. It sticks to the inside of the denture. You've got to clean that junk from the roof of your mouth. You've got to clean that stuff off from the inside of the denture.
Will you stop, please?
And then you've got to do it again the next day.
It's too painful to listen to you.
So who wants to do that? I mean, the idea behind here, if something on a dental prosthesis is not fitting correctly, see your dentist, ensure that it does fit correctly. Okay. For example, on an upper denture, you can do, let's say, a reline, or perhaps if that denture is just beat to high heaven, maybe it's time for a new denture.
But what actually, let me actually talk about something which completely apparently fixes it, and that is get implant-supported denture.
Precisely.
Couple to 3 implants, whatever. Every person will have a different reason, and it depends on the bones, whatever they need. It's still very, very cheap compared to lots of dentures. And you tell me, with an import supplanted denture compared to a normal one, where you can't eat an apple, you can't chew on a spare rib, you always feel a little uncomfortable it falls out. It might not fall out, but it feels like that. Do you know what I mean? Yes. Like a shaky car, you kind of go, I think it's going to fall apart. It doesn't, but it feels like that, and it's just not good. Right. And so can you, with an implant-supported denture, again bite into an apple? Can you again chew on a spare rib? And will you never need cream anymore, this adhesive, the glue?
I've done cases with implant-supported dentures, and the patients just love them. They just love them. First of all, let's take, for example, an upper implant-supported denture. You no longer have to have all of the plastic, which is called the acrylic, the pink part, across the roof of your mouth. So these things are supported just around the ridge in the front, and they're fixed into position. So they're going to work as close to your natural teeth as anything can. And people love them because once they get them, they're able to bite into steaks, apples, chew, whatever. No glue, no gunk, no in, no out. Easy
Beautiful.
to keep clean. And just with today's technology, if the case is planned correctly, the patient will have great success with it.
You said about, the acrylic, the plastic on top of it, I mean, taking that out, I mean, people who probably have a denture probably know it. The second they have it in it, they don't taste the food anymore because that's where you really taste it up there. It's not quite so much in the tongue than, a little bit, but not, most of it is up there in the gum. And once you have this plastic or metal, whatever it's made, you don't taste it. But so you say with the implant supported denture, you can take this off and you now actually, you can taste it again.
Absolutely. Absolutely. It does interfere with people's taste, and you just no longer have that in there. So people can enjoy food a whole lot more.
Beautiful. Good news. I mean, I know, we people, we kind of like, good news from a dentist, how the heck that does work. Like, I'm going to wake up, Yahoo, I need a root canal. That's just what I was waiting for. And again, while we're not waking up, Yahoo, I need an implant supported denture, Yahoo, I need a perio surgery. But one thing I have noticed dealing with so many doctors and things, there's no medical branch which actually can predict, prevent, and permanently fix a problem as fast and as predictable as dentists. That doesn't mean they're better. It's just their branch. God has made it that it is more fixable than even a common cold.
The technology helmet that has occurred in my practice, during my practice, it's incredible. I mean, it's absolutely incredible. They come up with stuff that, it's hard to stay on top of all of the technology in there, and it's just as you said, it's something that is very highly fixable for almost everyone that's out there. Everyone who wants to get it fixed out there.
I guess that's like with exercising and everything else. We the patients, we the people, we do need to go and do it. That's with education, that's with, we do need to then go and go through whatever pain it takes, whatever it takes to go and do it. Because it's too late afterwards to kind of say, I told you so. It is not a nice thing. It's because at that point, you lived your life not to the fullest because you can't traverse it anymore, like we just talked the dentures. You wear 20-year dentures and every few years you have to glue them and this and that and you just don't feel as vibrant as you would. You can't take those 20 years back. Yeah, you survived them, but why not live them to the fullest? Dr. Bedai, I appreciate talking to you. Bye-bye.
Okay, take care, Helmut.